MOA of finasteride and dutasteride in the treatment of BPH5 alpha reductase inhibitors. It inhibits 5-alpha reductase, which converts testosterone to DHT, which is a potent androgen that stimulates prostate growth. It reduces stimulation of further prostatic enlargement. 5-alpha reductase inhibitors reduce prostate size and improve LUTS and urinary flow rate. It inhibits type 2 isoenzyme of 5-alpha reductase and reduces serum DHT by 70%. But dutasteride inhibits both type 1 and 2 isoenzymes and reduces serum DHT by 90%. Adverse effects for alpha-1 receptor blockers, tamsulosin, silodosin, ulfusosin, prazosin for BP orthostatic hypotension, dizziness, floppy iris syndrome, urinary urgency, headache, nasopharyngitis, and hormonal contraception. Copper IUD dutasteride and finasteride can cause breast tenderness and enlargement as rare side effects. Common side effects are impotence, reduced libido, ejaculation disorder. Biggest anticholinergic side effects in first-gen anticholinergics. Oxybutynin is older non-selective anticholinergics. Anticholinergic side effects are more common with older non-selective anticholinergics. Solifenacin and darfenacin are second-generation, selective M3 antagonists. 1 mark MOA of combined oral contraceptive. 3 marks estrogen inhibits ovulation by inhibiting FSH release. Progestogen and estrogen combination prevents ovulation by inhibiting LH release. Progestogen also makes cervical fluid thicken and become less welcoming to sperm, more difficult for sperm to traverse it to reach the uterus and ovum. Together, reduce the receptivity of endometrium to implantation. MOA of solifenacin, darifenacin for BPH, second-gen anticholinergics. It inhibits the binding of acetylcholine at M3 receptors in the smooth muscle of bladder wall, suppressing M3, induced muscle contractility, and increasing bladder capacity. Although M2 receptors are also present in bladder wall in larger numbers, M3 receptors control bladder contraction and voiding window each day for contraception, 3-hour window each day for progestogen-only pill, and 24-hour window each day for COC reasons for combined oral contraceptive taken continuously, avoiding bleeds. People in iron deficiency. If people have debilitating and painful periods conditions associated with fluctuating hormone levels, first dose and orthostatic hypotension, are more experienced taking prazosin than tamsulosin. Ulfusosin, silodosin, tamsulosin are more selective for alpha-1, a receptor subtype in bladder and prostate. It minimizes side effects. Prazosin also blocks postsynaptic alpha-1b receptors in blood vessels to cause arterial and venodilation. Adverse effects for first-gen anticholinergics, oxybutynin, propiontheline, tolterodine. Anticholinergic effects including urinary retention, dry mouth, constipation, blurred vision, orthostatic hypotension, confusion. Sedation. Phosphodiesterase 5 inhibitor registered for lower urinary tract symptoms associated with BPH. Tadalafila benefit of mirabegron over antimuscarinics for treating urge incontinence. Better tolerated than anticholinergic agents. Includes tachycardia, increased blood pressure, severe hypertension, rare. Urinary tract infection at nostril implant can be removed earlier than 3 years. Medroxyprogesterone cannot be removed earlier than 12 weeks. How long does the intramuscular medroxyprogesterone act as a contraceptive for after administration? Works for 12 weeks. What is the difference between monophasic and multiphasic combined oral contraceptives? Is there evidence of a clinical benefit of one over the other? Monophasic COC contains same estrogen and progestogen dose throughout the month. Can be further classified into low dose, standard dose, and high dose of estrogen. Multiphasic COC, where the progestogen or both agents vary in dose throughout the cycle. They provide a more natural hormonal profile and reduce side effects. However, no advantage over monophasic COCs has been demonstrated, true or false. The levonorgestrel intrauterine device is not affected by drug interactions. 0. 5 marks, true. In the space provided, provide the drug class for each of the following drugs and the common indication for its use. Solifnasin anticholinergics for urge incontinence, tamsulosin alpha, 1 receptor blockers for BPH overflow incontinence, finasteride 5, alpha reductase inhibitors for BPH, desmopressin synthetic vasopressin analog. For nocturnal enuresis, mirabegrin, beta-3 adrenergic receptor, agonist for urge incontinence, drospirenone progestogen, only pill for contraception. 3 marks true or false. Mirabegrin can cause acute urinary retention due to excessive beta-3 adrenergic receptor activation. 0.5 marks, false. Explain the mechanism of action of oxybutynin in the treatment of urinary incontinence. Non-selective anticholinergics. It inhibits the binding of acetylcholine at M3 receptors in the smooth muscle of bladder wall, suppressing M3 induced muscle contractility and increasing bladder capacity. Although M2 receptors are also present in bladder wall in larger numbers, M3 receptors control bladder contraction and voiding. 3 marks. Can the use of ulipristal and levonorgestrel for emergency contraception enhance their efficacy in preventing pregnancy after unprotected sex? 1 mark, false. Used independently, true or false. Combined oral contraceptives are associated with increased risk of endometrial cancer. False, reduced risk of ovarian and endometrial cancer, which will persist for 15+ years after stopping. 0. 5 marks. Explain the mode of action of mirabegrin in the treatment of urinary incontinence. Mirabegrin is a beta-3 adrenergic receptor agonist that activates smooth muscle relaxation during the storage phase of micturition, allowing an increased bladder capacity. This helps to reduce irritative voiding symptoms, also increases the capacity of the bladder, leading to longer intervals between voiding. 3 marks. The combined oral contraceptive can increase the risk of thromboembolism in which 3 groups of patients. In obese, BMI 30, in postpartum individuals, history of VTE asterisk avoidin, people with migraine with aura, smokers. 1.5 marks. Which one of the following represents the mechanism of action of tadalafil? Alpha-1 receptor antagonist phosphodiesterase, 5 inhibitor 5-alpha reductase inhibitor beta-3 adrenergic agonist. 1 mark B for each of the contraceptive methods listed below. How long do they provide contraception for after administration? Etenodstrel implant. For 3 years levonorgestrel IUD. For 5 years medroxyprogesterone IM injection. For 12 weeks, 3 marks. Why is the dose of hormones in the vaginal ring lower than that of combined oral contraceptives? 1 mark. It avoids first-pass metabolism, so the daily dose is lower than oral preparations.